So the two infectious diseases that I will be covering today are pneumococcal pneumonia and hantavirus pulmonary syndrome. Pneumococcal pneumonia is a lower respiratory bacterial infection caused by the bacteria Streptococcus pneumoniae. It is characterized as lancet-shaped diplococci, so you can see that they are in short chains here, and they also stain purple, so they are gram-positive. They are a facultative anaerobe, so they can survive in the presence of oxygen and can also survive without oxygen. And the bacteria is surrounded by a polysaccharide capsule. Symptoms and transmission. There are many symptoms that one may experience if infected with Streptococcus pneumoniae, being fever, chills, sudden sharp chest pain, difficulty breathing, which could include shortness of breath, fast breathing, and hypoxia, which is not getting enough oxygen. You could also experience fatigue, weakness, and low levels of alertness and confusion. Pneumococcal pneumonia is transmitted through respiratory droplets by direct contact or by self-implantation, which is someone carrying the pathogen in the respiratory tract, which is also known as autoinoculation. So for treatments, the specific antibiotic treatments in mild cases, doctors may use amoxicillin to treat the bacteria, and in severe cases, intravenous ceftriaxone, cefotaxime, or amoxicillin clavulanic acid are antibiotics that could also be administered by doctors. If the infection goes untreated, it could progress to apnea, which is a collection of pus between the lungs and the inner surface of the chest wall. It could also lead to pericarditis, which is a swelling and irritation of the thin sac-like membrane that surrounds the heart. And lastly, atelectasis, which is complete or partial collapse of the lung or a section of the lung. There have been two vaccines that have been developed to help prevent pneumococcal pneumonia. The first one is the PVC-13 vaccine, which is recommended for babies under 2 years old and toddlers age 2 and older. 2 years and older with medical conditions. There's also the PBSV-23 vaccine, which is recommended for people that are 2 years and 64 years old with medical conditions, adults 65 years and older, and adults that smoke cigarettes who are between the ages of 19 and 64. Other precautions and preventative measures that could be taken is getting your flu shot, washing your hands, avoiding smoking, and keeping a distance from people that could potentially be carrying the infection because it is spread through person-to-person contact. A history of pneumococcal pneumonia. It is it's common worldwide, and most commonly found in the United States and Europe. There are over 150,000 hospitalizations each year just in the United States, and the first outbreak was in 1995 and 1996, and it occurred in chronic care facilities for the elderly. So this happened between October 1995 and June of 1996, and elderly people were getting sick, and doctors were trying to figure out what was going on. Um, on average, 13.9 of residents were infected in the states combined, and 6 patients died from the infection. So moving on to Hantavirus pulmonary syndrome, it is a lower respiratory viral infection whose causative agent is the Pneumonia. A look at it under the microscope here on the right, as you can see, and it is also negative sensed single-stranded RNA, and it is an enveloped virus. So symptoms and transmission of hantavirus pulmonary syndrome. The early symptoms someone may experience are fever, fatigue, muscle aches, more specifically muscle aches in large groups, dizziness, and vomiting. Late symptoms include coughing, shortness of breath, and fluid in the lungs. The late symptoms occur usually 4 to 10 days after being infected with the virus. Hantavirus pulmonary syndrome is a zoonotic virus, so it is transmitted through rodents, which could be found in their saliva, in their feces, and urine. It is spread through airborne transmission, so simply just being around that saliva, the feces, or the urine, and breathing it in. It can also be spread through direct contact if you touch an infected specimen or the nest, and then touching your eyes or your mouth. Treatment for hantavirus pulmonary syndrome. It is a very serious virus and very difficult to treat. So hospitalization does occur. Someone will most likely be admitted to the ICU for oxygen therapy and intubation. And in severe cases, doctors may try an antiviral drug, ribavirin, which is used to treat other hantavirus strains, but it's not proven to treat hantavirus pulmonary syndrome. So as of current, there are no vaccines and there is not a cure, and failure to seek treatment may lead to shock, failure of the organs, and death. This could result from a collection of the fluid in the lungs, and the heart will bleed and stop pumping. So since there isn't a cure or a vaccine, it's really important to take all the precautionaries that you can to prevent the infection. So sealing up holes and cracks outside your home, setting up rodent traps, wearing PPE during cleanup of droppings, saliva, urine, and nests, and disinfecting the areas of the rodent interaction. So here on the right you can see these are the 4 rodents that carry the virus most. So you have the rice rat, the white-footed mouse, the deer mouse, and the cotton rat. And these rodents are found in rural areas and very dry deserts as well. History of hantavirus pulmonary syndrome. The first outbreak was in 1993, which occurred in the Four Corners, which is where Colorado, Utah, Arizona, and New Mexico meet. And what happened was there was a young man who suffered a symptoms of HPS, and he died rapidly in the hospital. And when he was being treated by doctors, he made his doctors aware that his fiance died a few days earlier, who showed the same symptoms. And because he told them about his fiance, they believe that that's the reason they discovered the infection, is because they both suffered rapid onset symptoms and death within a weeks of each other. So it's a very it happens very fast. That's why it's very important to receive and address and get treatment as soon as possible. It's found mostly in the United States and Canada. As you can see here on the right, each state has a number of cases documented. And it is also found in Argentina, Bolivia, Brazil, Chile, Panama, Paraguay, and Uruguay. Some questions regarding both of the infections to consider. So maybe you would want to consider a pneumonia shot if you haven't had one before. And here on the right, you can see there's a flow chart here that could help you make that decision. And some questions regarding Hantavirus pulmonary syndrome are: do you live in a rural area, or have you ever had mice in your home? Like I said a little bit earlier, these rodents are mostly found in rural areas like field mice and in woods as well. So just something to keep in mind. Thank you for listening.